Today we're announcing 14 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 207. We still are able to say that the majority of our cases are linked with travel outside of Nova Scotia or connection with a known case. Today, that's about 92% of our cases we have that. But there's still some cases where we either haven't finished the investigation or we still have one that we know that the only conclusion we can draw is community spread. But we're seeing some signals of that make me increasingly concerned that we do have the beginnings of community spread here in Nova Scotia, as public health does all its follow-up at the local level. I'm pleased to say that we have 5 individuals in hospital. I have to correct, I misspoke yesterday. And I used the number 9, but it's 5 people that are in hospital. That remains the same today. We now have 21 people that can be considered to have recovered from their infection and they resolved their issues with COVID-19. So that's really good news. The latest number is 8,234 Nova Scotians who have been tested and have negative results. The QE2 lab did over 800 tests again last night, and this weekend they're moving to a 24/7 operation to further maximize their capacity to test individuals. And again, I want to echo my thanks to my laboratory colleagues for their creativity and hard work to make sure we have the lab capacity necessary. I was asked yesterday to provide an update on the investigation at the Magnolia Long-Term Care Facility. I spoke with the Regional Medical Officer of Health this morning, and he advised me that we still, and I'm pleased to say, there's still only the original 3 staff and 2 residents who have tested positive. There are no other staff or residents who have developed illness, and we continue to investigate that. There was both an educational event for staff, and now we've learned that there was also a family gathering on March 11th at that facility that brought out-of-province visitors. So, as I said previously, it's a complex investigation with lots of interactions between staff and residents and the community, and we continue to investigate that. But the good news is there's nobody new ill in that long-term care facility. There has been a lot of discussion and opinions and questions about masks in the last few days, and I'd just like to take a moment to speak to those. As I said yesterday, there's some growing evidence around potentially the effectiveness of the general public wearing masks. The Public Health Agency of Canada is looking at that, and and they'll be, as soon as they can, they'll be providing a review of all that of evidence to inform public chief medical officers of health in all the provinces and territories, and we'll use that to guide further actions. That all that information has been looked at on knowing that it's important. We have global and national supply challenges around masks, and it's very important that surgical grade masks are preserved and used for healthcare workers and other essential workers. So even now, if the public are choosing to use masks, it's really important that they do not use surgical grade masks. Those need to be preserved for those who truly need them. There are also a lot of questions and around healthcare workers. We continue to get a lot of pressure around using certain types of masks for healthcare workers. There are national guidelines developed by experts in infection control that guide infection control measures that we're using those in Nova Scotia, and they include directives on or guidance on what type of masks and other personal protective equipment are required to keep healthcare workers safe. We know that because COVID-19 is spread by droplets, it is not airborne spread, that there are only specific circumstances in a healthcare environment where an N95 mask is required. Now, especially when we have these supply challenges, as I said, globally and nationally, it's very important that we use masks as appropriate. And the pressure to use N95 masks, higher levels of personal protective equipment, where the evidence does not say that they're necessary, quite frankly, puts us into the possibility where in a few weeks' time, as we get more Nova Scotians in hospitals, that we may not have the supply of N95 masks that are necessary in circumstances where there's no disagreement at all that N95 masks are necessary. So it's the appropriate use of masks, both for the public and in a healthcare setting, is critically important at this time, especially in the situation when we have challenges on the personal protective equipment supplies, and that is a global issue. We're now into our fourth week of our experience with COVID-19, and we are you've heard me say this week, this is a very important time, if not a critical time. We are now starting to see signs of community spread in Nova Scotia. I do not believe it's widespread, and we are continue to expand our testing to be looking for spread within Nova Scotia, not just based on travel, and there'll be more to come on that in the near future. But it's the next few weeks as we start to get community spread, the extent, how much it spreads in communities and how many people become ill and how much pressure, how big the wave is as we move in towards the end of April on our healthcare system, quite frankly, depends on how we all work together to do the things we need to do to prevent the spread. So that is staying apart, staying home, as much as possible. We know that these are challenging directives for people and families and businesses, but it's critically important. The basic message is stay home unless there's essential reasons why you don't need to be at home. So we know everybody needs to go shopping. So have one person go and get groceries, go to the bank, get gas, go to the pharmacy. Limit those visits. Try to plan ahead. There's lots of online grocery store ordering options. Many of the pharmacies are delivering. So think strategically and try to visit maybe once a week, not every couple of days. Is not the time to have social gatherings, even though we've said social or 5 or less, but those are meant for essential times when people need to get together and to govern how people get together when they have to go to the grocery store and other things. It is unfortunate. It's the time to get to connect with each other, absolutely, but do it virtually. Do it by the telephone. An old-fashioned way of writing letters, all sorts of creative ways, but now is not the time to be getting together, even if you think you can do that while respecting that 6-foot distance. I was reading an article last night which talked about the concept of family units, and I know not everybody lives in families, but in groups of people together, that we need to think about that's that unit that has to stay connected but isolated from the rest of the community as much as possible. Every time somebody goes out into the community, it does increase the risk of taking the virus into the community or bringing the virus back into that family or home unit. So we need to minimize that as much as possible. So if you have a teenager who's going out to meet their boyfriend, or if you want to get together, even to chat with your neighbors, each of those puts your family unit at risk, but it also creates the opportunity for the virus to spread within our communities. If we strictly adhere to stay home as much as possible, and as well as hand washing and all those other methods of protecting yourself, we can minimize minimize the impact and slow down the spread of COVID virus within our communities in Nova Scotia. The next few weeks are absolutely critical. We don't want to be doing this after being lax for a few weeks, and then all of a sudden we wake up and we've kind of missed the boat because we've allowed COVID to spread more than was necessary, and we've not taken the appropriate steps to minimize that. Again, I recognize that this is challenging, but we have to do this to protect each other, to protect our community, and protect our healthcare system. We're all going to need that healthcare system at some point, and we need it to be there for when we really need it. As we head into the weekend, I really want people to hear that message, but I also want people to do things, do it in a sense of caring for each other, do it in a way that builds community, not tears community apart. And quite frankly, use common sense. We are getting, when I say we, my communications colleagues in the Department of Health and Wellness, we're getting flooded with people's questions about, can I do this, can I do that? Stop looking for loopholes, please. Use your common sense. It may be challenging, but it's actually not that, in my mind, it's not that difficult to understand. Stay home as much as possible. Stay away from each other. Stop looking for loopholes or reasons to try to get around this that puts us all at risk.